Doctor explains the 3-minute simple trick for a fuller and firmer erection. Gentlemen, if you are a man over 60, have you felt that frustrating sense that your body just doesn't have the same vigor it used to? That feeling of confidence, especially in the bedroom, isn't quite what it once was. Now, most men I see in my office, they chalk this up to one thing, just getting older, or maybe they blame their stress levels, or even their blood pressure medication. But what if I told you that for many men, a major culprit is a group of muscles you probably never even think about? And this isn't a guess, it's science. In fact, a landmark study from the University of the West of England found something remarkable. They discovered that targeted exercises for these specific muscles helped 40% of men regain completely normal erectile function. 40%. That's a powerful, life-changing number. But data is just numbers. Let me tell you about a real person. I remember a patient of mine. Let's call him Robert. He's a 68-year-old grandfather. He came to my office feeling, well, defeated. He truly thought his days of intimacy were over for good. But after we started working on this one simple, overlooked area, he told me with a huge smile on his face that he felt like a new man. Hello, I'm Dr. Audrey Wells, and in the next few minutes, I am going to show you the exact 3-minute daily routine that helped Robert and has helped countless others. It's a routine you can start doing today, right from the comfort of your favorite chair. All right. Now that you understand why this is so important, let's delve into the details, the routine itself. But first, we need to talk about the muscles we're going to be working with. The muscles we're targeting are your pelvic floor muscles. Now, I know that might sound a bit clinical, or maybe like something you've heard mentioned in a women's health context, but I need you to understand, these muscles are absolutely critical for a man's strength, control, and vitality. I want you to imagine a muscular hammock, a strong, supportive sling that stretches from your pubic bone in the front to your tailbone in the back. This hammock, this is your pelvic floor. It's what supports your bladder and your bowel, and it plays a crucial, direct role in your erectile function. When this hammock is strong and toned, everything it supports works better. It's that simple. So before we start the 3-minute routine, you must know exactly how to find these muscles. If you're engaging the wrong ones, you won't get the results. It's like trying to do a bicep curl by shrugging your shoulders. It just doesn't work. So here's a simple way to identify them, right now, wherever you are. I want you to imagine you are urinating, and you need to stop the flow midstream. The internal muscles you would squeeze, the ones that lift upwards to stop that flow, that's your target. That's your pelvic floor. Another way to think about it is to imagine you are trying to prevent yourself from passing gas. That subtle internal clench and lift. That's the feeling we are looking for. It is not about squeezing your buttocks. It's not about tightening your abs or your thighs. It is a precise internal movement. Take a moment and try that right now. Feel that subtle squeeze? That upward lift? Good. That's the muscle group we're going to build. Now that you've found your target, let's get into the routine. Okay, so let's get started. We are going to begin with the first exercise. Exercise number 1, the slow hold. This is the foundation of your entire routine. All right, the first exercise on our list is called the slow hold. Think of this as building the foundation of a strong house. Without this, nothing else will be as effective. It is the most important first step. But here's a critical mistake many men make when they first try this. They hear about doing a Kegel or a pelvic floor contraction and they squeeze. But then they immediately rush the relaxation. They squeeze. And then right away, they squeeze again, thinking that more is better. This approach can actually just tire the muscle out, making it fatigued and less responsive. It completely negates the benefits of the exercise. The magic, you see, is not just in the squeeze, it's in the controlled release. So, why is this slow hold so effective? It all comes down to building two things, endurance and control. This exercise is designed to teach those pelvic floor muscles how to maintain consistent pressure over time. This sustained pressure is absolutely critical for supporting healthy blood flow to the penis, and just as importantly, for keeping that blood right where it needs to be to maintain a firm erection. It's about building a muscle that doesn't just work, but a muscle that can last. And this isn't just a theory I have. This is backed by solid medical science. Research published in journals of physical therapy consistently shows that slow, controlled, isometric contractions, which is exactly what the slow hold is, are one of the most effective and safest ways to build foundational strength in these deep, supportive core muscles. It's a proven method for creating real, functional strength that your body can actually use. To put it simply, I want you to think of it like this. Imagine you are slowly lifting a very heavy bag of groceries off the floor. It's not about yanking it up and down as fast as you can. That doesn't build real strength. The real strength, the functional power, it comes from that controlled, steady hold as you lift the bag and place it on the counter. The slow hold does the same thing for your internal muscles. It's the control that builds the power. So how can you do this correctly and safely? It's very straightforward. While sitting, standing, or lying down, I want you to gently squeeze and lift those pelvic floor muscles, the ones we just identified. And as you squeeze, I want you to hold that contraction for a slow count of 3 to 5 seconds. Really feel that gentle upward lift. Then, and this is the most important part, you are going to relax those muscles completely for the exact same amount of time. 3 to 5 seconds. Don't rush this. Feel the muscle fully let go. That full release is just as vital as the contraction itself, as it allows for proper blood flow and muscle recovery. You're going to repeat this cycle. A 3 to 5 second squeeze, followed by a 3 to 5 second release, about 10 to 12 times in a row. The whole process should take you about 1 minute. That's it. I want to share something that Robert, the 68-year-old patient I mentioned earlier, told me. After just 1 week of doing nothing but these slow holds, he said he felt more, and this was his word, connected to that area of his body than he had in years. For the first time, he felt like he was in control, and he discovered a great little synergy trick that I want to share with you. For even better results, try to sync this exercise with your breathing. Gently exhale through your mouth as you squeeze and lift, and then take a slow, deep inhale through your nose as you completely relax. It's a small tweak, but it made a world of difference for him, and I am confident it can for you too. All right, once you have practiced the slow hold and feel confident in your ability to isolate those muscles, it's time to move on to the second minute of our routine. It's time for exercise number 2. Exercise number 2, the quick flick. Now that we've built the foundation with the slow hold, we're going to add a new dimension to our training. The next exercise is called the quick flick. And as the name suggests, this one is all about speed and responsiveness. It's about making that muscle not just strong, but also fast. But here is where I see another very common and critical error. When men try to do this quick movement, their whole body gets involved. In an effort to go faster, they start tensing their stomach muscles, they clench their buttocks, and they even tighten their thighs. I need you to understand, this exercise is all about isolation, precision. If you feel your whole midsection and your legs clenching up while you're doing this, you're doing it wrong. You're recruiting other large muscles to do a job that a very specific small muscle is supposed to do. This takes the focus away from the target and dramatically reduces the effectiveness of the exercise. So remember, this is a subtle, internal movement only. So why is this quick movement so important? Why do we need to focus on speed? Well, your body has different types of muscle fibers. The slow hold was designed to build endurance in what we call slow twitch muscle fibers. But this movement, the quick flick, is designed specifically to target your fast twitch muscle fibers. These are the fibers responsible for rapid, explosive, reflexive actions. In the context of erectile health, these fast-twitch fibers are what allow your pelvic floor to react instantly, to quickly clamp down on the veins that allow blood to leave the penis, effectively trapping that blood to create a firm, rapid erection. It's about improving your body's automatic response time. And again, the science on this is incredibly clear and well established. Neuromuscular studies, which look at the connection between our brain and our muscles, have confirmed for decades that rapid, repetitive contractions, just like the quick flick, directly improve what's called the neuromuscular junction. That's the point where your nerve tells your muscle to fire. By practicing this quick movement, you are essentially upgrading that connection. You are making the signal from your brain to your pelvic floor stronger, clearer, and much, much faster. This leads to a muscle that becomes more automatic in its response. It just works when you need it to. Here's the best analogy I can give you. If the slow hold, our first exercise, is like a big, slow-burning log in a fireplace that provides lasting heat, then the quick flick is like the spark from a flint that ignites the kindling. You absolutely need both to build a strong, roaring fire. One provides the endurance, the other provides the immediate reflexive spark. It's a quick on and off switch that gets everything started. You need that switch to be highly responsive. So how do you perform the quick flick correctly? For the second minute of your routine, you are going to rapidly contract and then immediately release your pelvic floor muscles. Squeeze, release, over and over. Unlike the slow hold, you are not holding the contraction at all. Think of it as a quick flutter or a pulse. The key is to focus on the speed of the contraction and, just as importantly, on making sure you achieve a full, rapid release after every squeeze. It's this quick contrast between on and off that trains the fast twitch fibers. You'll do this continuously for 1 full minute. Now, I want to go back to my patient, Robert. He told me that while the slow hold made him feel more in control, he said the quick flick was the real game changer for him. He said it was this exercise that really helped with the initial firmness and the speed of his erections. He felt that his body was finally responding the way he wanted it to, when he wanted it to, and he shared a wonderful little tip with me that I now share with all my patients. To practice this and make it a bit more engaging, try doing it in your car when you're stopped at a red light. Turn on the radio, and for a few seconds at a time, try to match the beat of a fast song with your quick flicks. It's a great way to train the rhythm and responsiveness of the muscle. If you're finding this useful, and if this is starting to make sense to you, do me a favor and go down to the comments right now and type the word vitality. It lets me know that this information is connecting with you and that we're on the right track together. All right, we have now arrived at the third and final minute of our daily routine. We've built our foundation. We've trained our responsiveness. Now, it's time to build our stamina. It's time for exercise number 3. Exercise number 3, the endurance hold. Finally, we have the endurance hold. As the name implies, this final exercise is all about building your staying power. It's what takes the foundational strength and the rapid response we've developed and translates it into lasting, reliable performance. This is what truly cements all the gains from the first 2 minutes. But I have to be very clear about this next point. The most critical and, frankly, the most counterproductive mistake that men make right here is holding their breath. When concentrating on holding a muscle, it's a natural human tendency to hold your breath at the same time. But in this case, it is the worst thing you can do. Holding your breath dramatically increases the pressure inside your abdomen and your chest. This internal pressure works directly against what you are trying to achieve with your pelvic floor. It puts strain on your body and can even negate the benefits of the exercise entirely. So please, remember this one thing above all else for this exercise. Breathe, normally and naturally. So why is this endurance hold the grand finale of our routine? It's because this exercise specifically trains the muscles to maintain that crucial valve closing effect. In medical terms, this is known as venous occlusion, and this mechanism is essential for sustaining an erection. Once blood flows into the penis to create an erection, the pelvic floor muscles must act like a clamp on the veins, preventing that blood from leaving too quickly. The endurance hold trains your muscles to be a stronger, more reliable clamp for a longer period of time. It directly builds stamina for sustained function. And the science here is particularly fascinating. Modern studies using biofeedback technology, where we can actually see the muscle activity on a screen in real time, have shown us something incredible. These studies demonstrate a direct, measurable correlation between a man's ability to perform a sustained pelvic floor contraction correctly and the duration and rigidity of his erections. The evidence is powerful. By practicing the endurance hold, you are quite literally training your body to more effectively prevent blood from leaving the penis, which is the physical key to a longer-lasting erection. Here is the simplest way to visualize what you are doing. I want you to imagine you are trying to stop a slow leak in a bicycle tire by pinching the air hose shut with your fingers. Just pinching it for a split second won't do much good. The air will just keep leaking out. To stop the leak, you have to apply strong, steady, continuous pressure. The endurance hold is you, training your internal muscles to be that strong, steady pinch on the hose, effectively preventing the pressure. In this case, the blood, from escaping. It's about maintaining that steady, powerful grip. So let's talk about how to perform this final exercise safely and effectively. For the last minute of your 3-minute routine, I want you to gently squeeze your pelvic floor muscles, just as you have been practicing. But this time, you are going to hold that contraction for as long as you comfortably can, all while breathing normally. Do not hold your breath. When you are just starting, a good goal is to aim for a 10 to 15 second hold. As you get stronger, week by week, you can gradually increase that time. After you have held the contraction for as long as you can, you will once again fully relax. Let the muscle go completely. Then you'll repeat this cycle. A long hold followed by a full relaxation, 3 to 4 times within your final minute. And this brings us back to Robert's story one last time. He said that the first 2 exercises brought back the function he was missing. But it was this one, the endurance hold, that gave him his long-term confidence back, that feeling of reliability, that knowledge that his body would not let him down. That is what this exercise gave him. And he also gave me a fantastic pro tip for this one. He said that to maximize this exercise, once you get comfortable with it, try doing it while standing up. When you're standing, gravity adds a little bit of extra natural resistance. This makes the muscle work just a little bit harder, leading to even better results over time. It's a simple way to increase the challenge and continue making progress. And that progress, that is what this is all about. So there you have it, your simple 3-minute daily routine. The slow hold for your foundation, the quick flick for your response, and the endurance hold for your stamina. 3 simple steps for powerful, science-backed results. But as I always say, knowledge without action is really just entertainment. So before you click away, here's your simple doctor's order for this week. A 3-step action plan to turn what you've learned into a real, lasting habit. First, for today, your only job is to practice finding and isolating the muscles. That's it. Just get comfortable with that feeling. Second, for the next 3 days, I want you to perform the full 3-minute routine, just once a day. And third, on the last 3 days of the week, I want you to challenge yourself just a little bit. Try to add just 5 more seconds to your final endurance hold. That's how progress begins. Now, I know what some of you might be thinking right now. I'm too busy for this. Or maybe, what if I forget to do it? Let me be clear, it is 3 minutes. 3. That is less time than it takes to brew a cup of coffee. So I want you to tie this new habit to one you already have. Do it right after you brush your teeth in the morning, or do it while you wait for your coffee to brew. If you have to, set a daily alarm on your phone for the first few weeks. Make it impossible to forget. Gentlemen, please understand. This isn't just an exercise. This is a powerful act of taking back control. It is a statement that you are not defined by the number on your driver's license. It is a commitment you make to yourself, to living a vibrant, a confident, and an independent life for years to come. So, if you are ready to make that commitment, if you are tired of feeling like a passenger in your own body and you're ready to take the wheel, then I invite you to join our community of men who are doing the same. Hit that subscribe button right now so you never miss these practical, science-backed guides. And even more importantly, I want you to go down to the comments section right now and type 2 simple words. Day 1. That is your public commitment to yourself, a declaration that today is the day you start. Let's support each other on this journey. Thank you for taking this time for your health today. In my very next video, we're going to be talking about the number 1 food that could be quietly hurting your prostate health without you even knowing it. You absolutely will not want to miss that one. Until then, stay strong and stay informed.